Now look, we have a great show planned for you all today. We're actually kicking things off in our LCMC Health Wellness Lounge because look, as kids are heading back to school, many of them are in school right now. A lot of them are going to be wanting to get into those extracurricular activities. But with those activities do come some consequences sometimes. Take a look at your screens, everybody. Did you know that more than 3 million children ages 14 and younger get hurt every year playing sports or recreational activity? In fact, the most commonly injured area of the body is the head or face in a number of sports, including cheerleading. But everybody, look, all of that can be prevented if you are knowledgeable as a parent and as a student as well on sports safety. We wanted to offer you all some tips today, so joining me now with some tips is Mr. David Gambel. He is the Director of Sports Medicine at Children's Hospital New Orleans. Welcome to the show, David.
Thanks, Malik, for having me. I appreciate it.
Yes, come on. Former football player for Brother Martin, everybody in the house, and now he's doing sports medicine. Thank you so much for talking to us about this. And I first want to start with this question. Obviously, parents want their kids to do what they want, right? They want them to do all the extracurricular activities. But when it comes to sports, they also know that it comes with injury sometimes. What advice do you have for parents on how to figure out and navigate, I want you to do what you want, but I also want you to be safe doing these sports?
Absolutely. So as a parent, it's great to encourage your child to be involved in things, extracurriculars, whether it's band, whether it's sports, any type of activity. Having them involved forms that friendship, companionship outside of the academic setting within school, but to do it safely. So there's some things that can be done on the front end before they begin activity to help minimize that risk of injury.
Yeah, let's talk a little bit about that. One thing you suggest is if your child is going to play a sport, get a physical. What does a physical look like? Because kids should be getting one every year.
Absolutely. So really getting a physical every year, that's truly the first step of making sure you're starting off to have a good, healthy season in your extracurricular activities. Typically, a physical will be done by a medical professional, typically your primary care physician or your pediatrician, and it needs to be done on an annual basis. So you'll go in for your physical, and what they will do is they'll review the athlete's medical history, see if there's any conditions that they need to be aware of, but they'll also look at the family's medical history. So anything of high blood pressure, diabetes, stroke, anything that might need to be looked into a little bit more to determine what modifications, if any, need to be done for your child to safely participate.
Good to know, parents. If you haven't had one yet, now is the time, especially as we head into this high school football season, which is going on right now. But I gotta ask you this, not only is it important to get a physical, you say making sure the child is hydrated and stretching is also incorporated as well. How does that benefit injuries not happening?
Absolutely. So hydration and nutrition are very crucial aspects. So nutrition, having a good balanced diet, some complex carbohydrates, good protein, lots of fruits and vegetables, drinking plenty of water, trying to stay away from those soft drinks and sugary beverages. All of those things will help you stay active and allow you to participate and compete in your activity at a high level while minimizing injury.
And why should they be stretching?
So stretching is going to help the body kind of recover. It's going to allow the body to get ready for that next session of activity, the next practice or the next game, and the seasons can be long, right? So going from football, I mean, it's starting now. These athletes have been going over the summer, starting off this week with games, but it's going to go all the way into November, December. Same thing with our volleyball athletes going right now. It's a long season, so making sure you're stretching, taking care of your body so you can last that whole season.
And you know, it's important that parents know some of the common sports injuries, right? What are some of the common ones that you want to let parents know about?
So there's a lot of injuries that can happen, right? We try to minimize that with doing things on the front end, proper nutrition and hydration, getting a good physical, but injuries sometimes are going to happen. So whether it's a fracture or a broken bone, that's a common injury that may happen. Sprains, you can sprain your ankle, you can sprain any major joint. Same thing as a strain, you can pull a muscle. Those are injuries that can happen over time throughout the athletic season. So you want to minimize that. And if you're doing those things on the front end, you're doing your best to kind of minimize any chance that you're going to lose some time playing.
And you know, there have been lots of documentaries, especially about football and injuries, concussions. Unfortunately for some, it can be deadly. What do you want parents who have football players, right, on the field this weekend, the next couple of weekends, what do they need to know? Because I know it can be scary, especially for the mom moms?
Absolutely. So concussions are big, but it's not just football. Like you mentioned before, cheerleaders, there's a high risk of concussions in that sport as well. Same thing with soccer, but it can happen in any sport. Concussion is a serious injury. So some things to look out for is if there's an impact to the athlete's head or neck area, they may demonstrate some signs or symptoms of a concussion. Headache, blurry vision, some slurred speech, difficulty remembering or concentrating. If your child is experiencing any of those conditions, it's definitely extremely important to make sure you're seeking medical advice and having them evaluated appropriately.
And making sure they have the correct equipment, whether it's any sport. What do parents need to make sure are put in place when it comes to equipment?
Yes, so equipment is going to help protect them, right? Different sports have different equipment requirements, from footwear, cleats, shoes,
headwear.
Like headwear with helmets, shoulder pads for football. It's extremely important to make sure that those fit specific to that athlete's body shape and body type. Can't be too big, can't be too small. You also want to make sure it's in working order, that it doesn't appear to be broken or used in the past or not in good working condition, so that way it will protect the athlete.
And you know, we're talking to the parents right now, but I want you to give a piece of advice to the kids, right? They're the ones who are playing the sports, everybody. What is that piece of advice that you can give them?
So they need to be really active in their health. From the nutrition standpoint, from the hydration standpoint, they really can help take those factors and own that, so they can take that nutrition and have good nutrition, hydrate throughout the day so they are able to participate. But the real big component that they need to be aware of is not to be afraid to communicate with your parents, communicate with your coaches. If you're experiencing something's bothering you or hurting you, making sure you're expressing that with an adult so that can be evaluated or looked into so it doesn't become a bigger problem later on.
It's so important. Talk to your parents. Parents, talk to your kids. Open communication is key. Look, David, thank you so much for joining us today in our LCMC Health Wellness Lounge. And look, everybody, for more good information about keeping your kids safe while playing sports, you can log on to chnola.org or give them a call at 504-899-9511.